Neck arthritis or cervical spondylosis. Let's talk about it. So in neck arthritis, there is wear and tear of the spinal discs of your neck. The discs become dehydrated, shrink, and lose height. This causes the spinal bones to get closer to each other, creating potential pinch points for the nerves. Also, due to increased levels of inflammation in the neck, bone spurs can form, which are also pinch points for the nerves. Cervical spondylosis or neck arthritis is common in people over age 60. With over 80% of this population suffering from it. If caught early, conservative treatments consisting of medication, massage, and physiotherapy can be very effective, and surgery can possibly be avoided. Now notice, I said surgery can possibly be avoided. There's no 100% guarantee. So, what are the symptoms of neck arthritis or cervical spondylosis? Initially, in the early stages, there will be no symptoms, but as it progresses, you will get pain and stiffness in the neck. Depending on how far it progresses, the exit points of the nerves can become pinched, or even the spinal cord within the spinal canal can become compressed. At this point, you may experience pain, tingling, numbness, or even weakness in one or both arms. There may also be a loss of coordination while walking, or even a loss of bowel or bladder function. So, as we age or fail to maintain our bodies, there can be changes to the bones, the discs, the ligaments, and the muscles of the neck. So let's talk about these changes now. So let's start with the disc. Typically, a disc is made up of a tough outer ring that encircles a jelly-like center. This structure allows the disc to act as a cushion, as well as to allow mobility of the neck bones. By age 40, the discs begin to dry up, and then they lose height. And this causes the bones of the neck to move closer and closer together. This may lead to bone-on-bone contact and possible nerve pinching. The outer ring may also develop cracks, and the jelly-like center can bulge outwards, leading to nerve pinching or even compress the spinal cord. This is what we call disc herniation or slip disc or disc bulging. These terms are used interchangeably in a loose fashion. Now, as the discs break down, inflammation in those areas will rise. And when inflammation is present for weeks or months, the body will begin to lay down new bone tissue in a possible attempt to strengthen the area. This new bone tissue is what is seen as bone spurs on the x-ray. These bone spurs can also pinch nerves, leading to pain, tingling, and numbness in the arm. The tingling sensation that you feel in the arm is what is also known as junjini in our local slang. The ligaments of the neck that help to hold the bones together have a certain degree of flexibility to allow pain-free movement. However, with age, the ligaments can become stiff and less flexible, so that movement becomes painful or more difficult. Now, as we get older, our life responsibilities increase, and we may not find time to exercise, or we may have an office job or a driving job that may have us holding our head and neck in a certain forward position for hours at a time. This can lead to stiff muscles or muscle spasms. Now, if you have neck arthritis and then you develop muscle spasms, the muscle spasms can now add another layer of pain on top of neck arthritis pain. Also know that tight neck muscles are a risk factor for developing neck arthritis, and they are also an accelerating factor for the progression of neck arthritis. So, what are the risk factors for developing neck arthritis? Age is a risk factor. Now, of course, the body will undergo the natural age-related changes. However, we do tend to neglect our health as responsibility comes with age. But know that our health is also one of our responsibilities. So we need to make time to exercise, get proper sleep, eat healthy, and supplement properly. Do not simply accept bodily degeneration and blame it on age. Genetics. Some people will be more prone to neck arthritis, but again, lifestyle choices can determine whether or not genes will actually express themselves. You are not to simply accept that you will develop neck arthritis just because it runs in the family. The type of job you have will also affect your risk of developing neck arthritis. Office workers, drivers, mechanic, AC technicians are at risk due to the neck positions they need to achieve in order to work. Now, if you are in a job that puts you at risk for neck arthritis, after the day is done, you need to perform certain exercises and stretches to minimize the chances that you will get neck arthritis. Now, neck injuries due to a car accident, a fall, or even a sports injury can increase your risk of developing neck arthritis in the future. This is why neck therapy is an important part of your recovery process. A therapist can assess you properly and develop a proper recovery and maintenance regimen for you. Smoking. Smoking tends to increase the risk of a condition called degenerative disc disease or DDD. In smoking, the nicotine causes constriction of the blood vessels that are around the disc, and this reduces the amount of oxygenation and nutrients that are supplied to the discs of the neck. Over time, this reduced oxygen and nutrition will lead to weaker discs. Now note that if a disc bulges and compresses on a nerve and the compression is severe, you may end up with permanent damage of the nerve. So now, how do we diagnose neck arthritis or cervical spondylosis? Initially, your doctor will ask you to move your head in a number of directions to see if you are experiencing pain at any of those head positions, as well as to determine if there are any restrictions to your movement. Additionally, your doctor will need to know if any arm or hand pain, tingling, or numbness is triggered by any particular head position. Now, for example, let's just say you tip your head in this direction and you begin to get some symptoms in the hand or the arm. That may point to a disc bulge on that side of the neck. Reflexes and muscle strength of the limbs may also be tested, as well as your walking pattern observed. Nerve and spinal compressions may reveal abnormal test results when these tests are performed. Additionally, imaging such as the X-ray or the MRI can be done to reveal more information about your neck. Depending on the results of the initial test, you may be referred to a neurologist to have nerve conduction tests performed. So now, how do we treat this condition? So the goals of treatment will be to restore any lost range of movement as much as possible, reduce or eliminate pain, ensure you can go about your daily activities and perform your work duty. To achieve these goals, a combination of anti-inflammatory and muscle relaxation medication can be used. Additionally, if you are having severe symptoms in the arm due to nerve compression, a short-term course of anti-seizure or antidepressant medication can also be used. Trigger point injections into the trapezius and the upper back muscles can be done to release knots or trigger points in these areas. In neck arthritis, surrounding muscles can become tight and trigger point injections can be used to relax them. Also, massage, stretching exercises, electrical therapy, red light therapy, neck traction, and dry needling can also be used to reduce pain and restore function. Now, if you are doing neck therapy, you will also have a home regimen that the therapist will recommend for you. In between clinic sessions, you are to be doing your exercises at home and not rely solely on the clinic sessions. You need to remember that you have an active role in your recovery. Now, if the conservative treatments, that is the medication and therapy, are not working or your symptoms are getting worse, you may need to be referred to a neurosurgeon and discuss your surgical options. So I hope you enjoyed that brief overview on neck arthritis or cervical spondylosis. If you have any questions or you want to book an appointment for therapy or to have a doctor's assessment, you can call or WhatsApp 747-5297 or 308-3370. We are located at number 4 Chincuna Gardens in Chinchin Road in Cunupia, just 1 minute away from the Cunupia Police Station. Feel free to send us your x-rays or medical reports on WhatsApp.
You can tap the description below for all of our contact information.